Om Shanti and welcome everyone. And we have a very special evening with two very powerful souls. We have done service with Dr. Bhavin in many different venues and some at the Sikh Gurdwara. We attended there once, and the mental health fair that he had put together at one of the colleges here locally. And so we're very happy to have him. And of course, Yogesh Bhai from Turkey and Istanbul Center. And so we'll give a little bio on both of them. And so those of you who are here for the first time, we'd like to introduce you to the Brahmakumari. Om Shanti. Okay. Om Shanti. Om Shanti. Welcome, welcome. We have centers in over 125 countries, and the centers are growing all the time. Every year, there's more and more centers added. And so we are an organization that was founded in 1936. And this gentleman up here, we honor him with his picture, and he is the founder of the Brahmakumari, one of the founders of the Brahmakumari. There's more than one. And he had a series of visions. And so all of this transformed from that. We are a women-led organization, the largest women-led organization in the world. And it is very beautiful how he, at one particular point, decided to turn over the organization to women. And you can imagine in 1936, that was unheard of. Women were still under the veil. And so now things are quite different, and we have women moving into leadership positions. In fact, I was just reading not too long ago about in America, women only got the vote in America like in 1920. And it started like in the 1800s, and it took them that long for women to get the vote in America. So this isn't something that's just secularized to India, but it's global. And of course, we honor these powerful men that support us in so many ways. And we're always appreciated of the brothers in the Brahmakumari. All right, so we'll get started. And my name is Johnny. I've been here in Sacramento for 20 some years. And I'm one of the students here. And Krishna, you want to introduce yourself, Krishna?
Om Shanti. Welcome you all. And most of you, we know each other. And thank you, Baba. And I would like to welcome Bhavin Bhai. He is one of the backbone of our community. And also he is a psychiatrist and doctor, experience of 30 plus years. And we have, of course, wonderful Shol has given time for us from Turkey, and the Sister Johnny will give their brief intro. So myself, Krishnagiri, thank you very much. Om Shanti, and Om Shanti, our Zoom listeners, sisters and brothers on Zoom, thank you for joining us on Zoom. So thank you. We hope we all enjoyed the wonderful session this evening. Thank you. Om Shanti, sisters. Johnny, thank you. And also this is we are going live on Facebook, so BK Center, yeah, so it's on Facebook as well, and I'm gonna also tag that, so we will be seen almost all over the world. Thank you. Om Shanti.
All right, so we'll give a brief introduction of Dr. Bhavin. And Dr. Bhavin is a board-certified psychiatrist and geriatric psychiatrist with over 30 years of medical experience serving with the Department of Psychiatry at Kaiser Permanente, South Sacramento. Known for his warm, compassionate, and person-centered approach, Dr. Parekh believes that every patient deserves personalized care built on trust and genuine human connection. His goal is to help people feel comfortable, understood, and supported throughout their mental health journey. Originally from India, Dr. Parekh, excuse my Hindi, brings a unique appreciation of both Eastern and Western cultures to his practice. Beyond medicine, he is dedicated to community leader and philanthropist serving on the board of organizations, including the Indian Association of Sacramento, the OCA, Asian Pacific American Advocates, and the City of Elk Grove's Diversity and Inclusion Committee. He enjoys spending time with his family, traveling, photography, bicycling, and playing cricket, while actively volunteering to strengthen community and well-being. And so now we have Yogesh Pai. Okay. Oh, is that better? Okay. Now, Yogesh Pai was born in Mawali, Africa, with an Indian background and brought up in London and Oxford, England. Yogesh Sharda has been a professional development trainer and workshop facilitator for over 30 years. Excuse me, presenting many hundreds of seminars, workshops, and courses for businesses, hospitals, and universities, youth organizations, and local community groups throughout Europe, UK, the Middle East, Southeast Asia, Australia, USA, Central and South America, the Caribbean, and India. Over the last 25 years, he has been in and around Turkey making presentations on topics such as stress-free living, effective communication, the secrets of self-esteem and positive thinking, team building, discovering the self, the principles of inner leadership, motivation and empowerment, decision-making, the art of relaxation, and problem-solving through meditation. Appreciative inquiry, emotional intelligence, anger management, personal excellence, and there is a list here. We wouldn't have enough time to read all these, but it is all the organizations and businesses and so forth that he has facilitated at and benefited many. All right, Krishna.
Om Santi, everyone, and Namaste, and I say Jai Shri Krishna. Thank you, Sister Hansa, Sister Joni, and Brother Krishna for your wonderful introduction. And whenever they invite me here, I feel like I'm coming back home. They always treat not just me but every devotee, every guest with welcoming attitude, with warm feeling. So always I feel good when I come here, and when I leave, go back to home, I feel very energetic and refreshed. So thank you for spreading positive vibes in the community. and we come across with them and do so many events, as a collaboration, Winterfaith Council, City of Pearl Grove Indian Association. So it's a good, uh, joint collaboration to benefit and to uplift our community. So it's a very important topic today, and personally, I like to learn from our brother Yogesh to, different aspect of benefits of mindfulness meditation. Of course, I can at the end share my experience as a psychiatrist and as a medical professional, how it benefits individual holistically when you combine modern science along with the Eastern methods. So I have so many examples that I will share at the end. But before I do that, I like to give the podium to our brother Yogesh to say, enlighten us about your expertise about and share your experience regarding mindfulness and meditation. Thank you.
Thank you. Thank you, Dr. Bhavin. And I also look forward to hearing your insights and learning from your experience too. So I'm delighted and honored to be here. I've been here, it's my third day here. And sharing some insights about the science of meditation and also how it can strengthen our minds. I came into this study of Raja Yoga meditation when I was quite young. I was around 8 or 9 years old. And so it's been a lifelong journey for me. And one of the things I was quite surprised at as I grew up is how little attention people pay to their inner world. We have the outer world of our study, our career and family and travel and so on. And of course that's important. But then there's the inner world, our thoughts, our emotions, our beliefs, etc. And it was surprising to me that people give the majority of their attention to the outer world and relatively little to the inner world. And I believe due to this imbalance, there are the stresses and strains which we see in life today, both in individuals and also in relationships with others. And also you could add to that in the global scenario. And if we learn to take better care of our inner world, we develop essential human abilities which allow us to live a more happy and more peaceful life, such as self-respect, dignity, the capacity to be able to tolerate, to forgive, to let go, and so on. And I firmly believe that the whole of life is essentially a mind game. Now, if you look at some of the main endeavors in life, they are all a mind game. Think of sport, for example, especially individual sports like tennis. Any tennis fans here? Okay, not so many. Anyway, especially a game like tennis, a large part of it, it's a mind game. You have to know how to focus your mind, how to concentrate, how to motivate yourself, how to forget the last mistake and focus on the next point. Business is a mind game. Politics is certainly a mind game. The whole of life is a mind game. Handling criticism, handling praise, dealing with failure, sometimes being the center of attention, sometimes being completely ignored. If our mind is strong and is stable, it also impacts our physical health, as Dr. Bhavin will, I think, touch on later as well. And so how does meditation help in all of this? Well, the word meditation comes from the Latin word medere. And medere essentially means to heal. So meditation is a kind of healing of the mind. Now, a person may say, well, my mind is not sick, so I don't need meditation. But here's the news. Everyone is sick today. In terms of comparing to the truly healthy state, true inner well-being, we consider, so when we experience any kind of dis-ease, anxiety, fear, even anger, all of these forms of dis-ease of the mind, if we allow them to persist, they can become disease in the body. And so the aim of this meditation we practice here, Raja Yoga meditation, is how can I be a Raja or a master or a king of my own mind? It's my mind, so my mind should be in my control. Would you concur? Would you agree? Just as we have arms and legs and we expect them to be in our control, in the same way, the mind is one of my non-physical organs. I should be able to have some kind of control, order over my thoughts. But when we feel upset, angry, dejected, depressed, at that moment, my thoughts are not in my control. Now, who here already does some kind of meditation? Just raise your hands. Okay. And who here is a meditator? And who is wondering what is the difference between the two? Yeah. Well, many people in the world do some kind of meditation to de-stress, to calm down, and to handle the challenges of life. And that can be enough for a person. But to be a meditator means it is a lifestyle. And that means as you pass through the day-to-day life, going to work, taking care of your family, being with your friends, doing all of that, but one part of you at the same time is naturally vigilant or aware and checking to see what am I doing with my thought energy? How am I spending my thought energy? Now consider the example of an athlete who wishes to win the gold medal in the races. So for her or for him, eating healthy is a lifestyle. Such a person has a mindset which includes taking care of his or her diet. Such a person will naturally be aware what I eat, when I eat, how much I eat. Because for an athlete, maintaining optimum weight is essential. In the same way, a meditator is a mental athlete. As we pass through the day, we want to respect and take care of how we are choosing to spend our thought power. Because meditators are very aware, my thought energy is the most precious resource I possess. And here is a cast iron guarantee. If you take better care of your thought energy expenditure, everything in your life will upgrade. Your peace of mind and your happiness will become deeper. Your physical health will be positively impacted. Your relationships will harmonize and stabilize. And even your performance at work will improve. Why? Because life is a mind game. The mind produces thoughts. Those thoughts also carry feelings with them. Now, the mind has a mechanism by which it works. Think of any machine you buy. It may be a phone, it may be a laptop, maybe even a car or a washing machine. What comes along with the machine? What comes in the box when you buy a mobile, for example? You get a user guide, a user manual, which tells you how to use that machine correctly and also how to maintain it. And so the question arises, where is the user manual for the mind? How are you supposed to use this thing called mind? What kind of thoughts are healthy, meaningful, useful first thing in the morning? How should you put the mind to sleep at night? How much thinking is enough when you fail at something, for example? So, question here, what is your relationship with failure? When you fail at something, how do you feel? Sad, stressed, depressed? For how long? Huh? Who sets the rules? How long should you make yourself suffer? These things are important to take good care of the mind and keep your mind positive and happy. Now, we can take the example of a baby. The first thing we all fail at is walking. Okay, now you probably can't remember, nor can I, but those who are parents will know that the first time baby tried to walk, she or he must have fallen down 5 times, 10 times, 50 times. And what do you do when baby falls down? Yeah, you lift him or her up. Okay, try again, let's try again until you learn to balance these things, until you learn to strengthen the muscles in the legs. In much the same way, your mind is like a baby. And just as we positively speak to the baby with encouragement, in the same way, we have to have a positive self-dialogue with our own mind. Encourage the self, talk positively to the self, enable the mind to feel positive emotions. Now, can you imagine if first time baby falls down, if the parents were to say something different? Let's say baby falls down first time. Parents say, this walking is not for you, is it? Don't waste your time with this walking business. If we said that, even for the whole life, we would still all be crawling. Taking care of the mind, having a good relationship with the mind, should be part of our daily program. So one aspect of strengthening the mind, check your inner dialogue. How do you talk to the mind? And make that inner dialogue positive and also productive. And if that becomes a habit, then we continue to grow and maintain our self-esteem. Now, what is the science of meditation? How do we do meditation? Well, there are so many different types of meditation, but in my experience in this Raj Yoga meditation, here are the steps involved. First, let's look at some practical examples to understand concentration. Let's say, for example, I place you in front of a TV and I ask you to sit in a chair and watch your favorite movie for 2 hours. And I say, sit here, watch the movie, for 2 hours and don't wriggle around much, don't move around much. Be focused. Could you do it? It's your favorite movie, remember? Okay, 1.5 hours then. Yeah? Not too difficult, right? All right. Let's take a second scenario. I ask you to sit in the same chair, look at the same screen for 2 hours. Don't move around much. But this time, the TV is off. Nothing showing on the screen. Could you do it this time? No? Or more difficult, I would say. What's the difference between the first scenario and the second scenario? Yeah. Where was the film happening? Was it happening on the screen? Or was it happening in your mind? Yeah? The screen is not a living thing. It is showing some images and generating some sounds. And those images and sounds are producing thoughts, ideas, and emotions in your mind. And you enjoy the experience of those emotions and ideas. And that a film can take you on an emotional roller coaster inside yourself. You're sitting in a darkened room in a movie theater for 2 or 3 hours, and you're having an emotional experience. Compare that to, if you go back 200 years, or if you bring somebody from 200 years here today, and you say, we're going to go to the cinema and watch a movie, he'd think you're crazy. How can that be fun to sit in a dark room for 2 hours and look at a screen? But in the same way, this is a little bit about what is happening in meditation. Where there is interest and there is enjoyment, concentration is natural. Where interest and enjoyment are not there, then concentration is poor. It's rather like a student who needs to study for an exam but doesn't feel like it. One part of that person is saying, tomorrow is the exam, focus, concentrate, study. Another part is saying, it's boring, I don't want to do this. So what's going on inside the self? That part of you which knows what is the right thing to do is called the intellect. That part of you which doesn't feel like doing it, that is called the mind. Mind is the child, intellect is the parent. Mind is what you feel like doing, intellect is what you should be doing. And when there is a mismatch between these two, that is poor concentration. But when those two things come together, mind and intellect, that is known as concentration. The result of concentration is absorption. It goes in. So first step in the science of Raj Yoga meditation is contemplation. Before reaching concentration, step one, contemplation. And contemplation means we take our mind in a direction with suggested and sequential thinking. The mind is not to be let loose. The mind needs to be guided. Why? Because it already has some bad habits of overthinking. And so if we wish to experience meditation, the mind needs to be guided. And that is where, especially for beginners, we do suggest using a meditation commentary. So contemplating suggested thoughts over in your mind. The second thing which helps concentration is called visualization. And that, as the term suggests, you create a visual image and you try to hold it. Now, some people are more contemplative, other people are more visual. In Raj Yoga meditation, we use both of those. Create a visual image, at the same time, contemplate suggested thoughts. So these two things together, contemplation and visualization, they create the condition known as concentration. And concentration then leads to experience, and that is known as meditation. Meditation is not thinking. Meditation is not thinking. Meditation is the experience of selected thoughts. Now, before we go further, let's do a little experiment to experience this. A simple visualization for beginners. Okay to do this? All right, so I ask you to have your back straight if you may. Just have your feet flat on the floor or on the block, maybe under your feet. Allow your hands to be free. You can have them resting on your legs if that's okay. And yes, good reminder, make sure your electronic baby is sleeping. That was a good timing because they suddenly wake up. Okay, so for this particular exercise, if you wish, you may close your eyes or have them open if you prefer. So I will speak out a simple guiding commentary and just follow as best as you can. So we take these next few moments just to relax the body and also to relax the mind. There is a world outside of me, but there is also a world inside me. And the world outside is the world of sound and movement. It is the world of actions. It is the world of doing. I cannot control the world outside of me, but the world inside me is in my own hands. My thoughts create my feelings, and I can choose the thoughts I wish to create. So now just bring your attention up to your face. Bring your attention to the center of your forehead. And here, at the center of your forehead, picture a small room. This tiny room in the center of your forehead, this is your quiet room of peace. Just visualize this very pleasant, quiet room of peace in the center of your forehead. And this is your private and personal space. And when you are inside your quiet room, you feel very relaxed. This is the place where you can be yourself. Inside your quiet room, you are safe. You are secure. You are free from the pressures and the demands of the outside world. Inside your quiet room, you are able to let go of all your daily roles and responsibilities. Feel the peace and the wonderful silence of your quiet room. And just allow your mind to absorb this atmosphere of serenity, tranquility. And as you do so, the thoughts slow down. The mind becomes calm, quiet, relaxed. Peaceful, stable, strong, and free. Just be with this feeling of peace in your mind for a moment. Okay, and when you feel ready, you can just open your eyes. So how do you feel? Yeah. And if this works for you, then definitely try to do at least once a day. The mind needs it, and the mind deserves it. We know that as technologies have improved and increased, and there are tremendous technologies in upgrades in communication, healthcare, travel. At the same time, we have to take care of the technology inside, and that's the mind. We have to respect that. It's not normal for the mind to have to respond to so much information. This is not normal. Having a machine next to you and it's always telling you, respond to this, like this, and take care of that. So spending at least a few minutes every day, withdraw from the doing mode, come to the being mode. Go to your quiet room, relax, recharge, refocus, come back to your meeting or whatever you are doing. I'll just finish with one last thing, and that is this, the importance of aligning yourself with the rhythms of the day. And as I was mentioning earlier, when we wake up in the morning, it's a very important time to set the whole day. Now, some people do say if they're having a bad day, I must have got out of the wrong side of the bed. Do you say that here too? No? Indicating if the day is going bad, it must have started off incorrectly. But the opposite is also true. If you start the day well, it has a positive impact on the rest of the day. Just as we take care of our bodies, if we want good health, we have to take care of them. For example, who here likes ice cream? Any ice cream lovers? Should be everyone. If you didn't raise your hand, what's wrong with you? But if somebody offers you ice cream for breakfast, like 7 in the morning, what would you say? Most people would say, well, maybe a bit later, because it's not a breakfast food. You know, to have that intake of sugar first thing in the morning, maybe not so healthy. So to have good health of the body, you respect what you give the body. Same with the mind. When you wake up in the morning, before you check the news, check the messages, even come into conversation with others, can you first be with your inner self? Can you feed the mind a peace experience first thing in the morning? Spend some time in meditation. Now, some people say, I can't concentrate. I sit and I start thinking about other things. Start with baby steps. In that case, don't do too much too quickly. Even just a few moments. Be still. Be with that thought. I am a peaceful being. I am a peaceful soul. Visit the peace inside you first thing in the morning. Then, through the day, at least a couple of times, do these things which we call as traffic control for the mind. You know? It's like, speed humps in the road. We also call them sleeping policemen. As you drive along the road, there's a speed hump and you need to slow down. And so maybe one mid-morning, perhaps 10:30 or so, one mid-afternoon, perhaps 2:30. These are mini meditations. It can be maybe just 3 minutes. Go to that quiet place inside you. Refresh the mind. And lastly, how to finish the day. Again, just like any machinery needs to be turned off. With a computer, you may log off, switch off, turn off. There are steps involved. In the same way, important to allow the mind to let go of the thoughts of the day. In one analogy I was told when I was a kid, think of the whole of life as a big theater performance. And think that for today, the curtain has come down. Today's performance is over. Maybe you did something amazing. Maybe you made some ridiculously silly mistake. Maybe you were the toast of the town. Maybe you were the villain. Whatever happened, today is over. The curtain has come down. Multiply everything by 0. Allow the mind to let go of the thoughts of the day. Let the mind be light, and then go to sleep. And then the sleep is more deep and restful. The next day really feels like a new day. So if we implement these simple practices in our lives, experiment for 1 week if it's new for you. See how you feel at the end of that week. Most people say, yeah, I want to do this as a lifestyle. I feel more stable, my energy levels are higher, and I'm more useful to everyone around me. So I think I need to stop there. Let our good doctor come in. He's been patiently and respectfully listening. Thank you for that. But I think we'd like to hear from you as well. Thank you.
Full and a very insightful, meaningful presentation. And the way he helped us to practice meditation, I felt that I was going to start snoring. I don't know whether I snored or not, but it was so peaceful and calm. I forgot everything what I had, stresses in my life, especially today. So I'm going to talk about, Eastern method. This is very powerful, our historical method that we've been practicing for thousands and thousands of years. And here in my practice, when I do mental health, before I was a physician, internist. So a lot of patients I would see with the high blood pressure, cardiac problem, heart disease, stroke. Now I see a lot of patients with depression, bipolar, schizophrenia, anxiety, suicide attempt, and I also do geriatric psychiatry, so I see a lot of memory, patients with the cognitive impairment we call dementia. And you see tremendous benefit with this kind of method. Of course, we have our medications, we have a lot of, high-tech technology methods to treat all this disease, but we cannot shy away from this powerful, methods. Like just now, just think about it. And I'm going to ask you how. Let's start from the head. When you did meditations and when you opened your eyes, how did you feel in your mind? What was the? I heard somebody say I was feeling calm, relaxed, right? So I want to start from the brain. What are the positive effects you have experienced just now, 2 minutes ago? Anybody wants to volunteer? Somebody said something? So I think you felt a very calm and relaxing mind. So, a lot of time with our daily life, we always worry so much about, work, coming home, cooking, taking care of the kids, managing money. Nowadays, people worry about the making or losing money on stocks. And Brother Yogesh said, even so much temptation on social media. When we wake up in the morning until we sleep, we cannot leave, our electronic body. So that causes significant release, of stress hormone we call cortisol. So in our brain, we have a frontal part we call prefrontal cortex, this part of the brain which manages your executive functioning, meaning managing your planning, sequencing, organizing your day. It helps with your concentration. You behave in a social norms, appropriately. You properly dress. So everything is controlled by this part of the brain. So somebody who's drinking too much, alcoholic guy, will have a disinhibition, mean this part of the brain will get out of control and they will drive recklessly or kill somebody, or they get violent, or they get, pass out. So when you meditate, what it does, this prefrontal cortex, the blood vessels over there, you get such a improvement of the functioning. The blood vessels get very big, or we call vasodilatation, meaning you get enough oxygen in that part of the brain, so your prefrontal cortex feel relaxed, so you're able to make a good decision. So now after the meditation, my consciousness out, with outside world is more powerful. I'm going to be more conscious, making good decision. I'm going to be, functioning much better. So you can feel that. And then you have part of the brain which called hippocampus, works with your memory. So you feel more, powerful cognitively. You're able to remember more. Suppose if you have a lot of stress that day, your memory will be impacted. You'll have a lot of, short attention span, and that will impair your memory. So you're going to see the benefits in your memory. Also, coming down, like eyes, you might have noticed your pupil, your eyelid, your eye muscles, your eyes were closed, so your eye muscles got rested, your pupil inside got rested. So when you open your eyes, you feel more clear vision, right? That's a benefit. And there is a lot of things I can talk about how that happens physiologically. Nose, same thing, it can improve your smell, and then ear, what Yogesh brother said, that it kind of your inner psychic, your inner consciousness helps you to shut off from outside sound, outside worries. So your inner brain, you don't have to worry about too much noise because you're ignoring completely. So your cochlear nerve, which helps with your hearing, gets better. Your hearing will improve. Your inner function will improve. Inner function, and the gait also has a lot of coordination. It works pretty back to back. So your gait will improve. Your coordination will improve. Somebody who has a tinnitus or tingling, sometimes they'll feel dizzy. Their gait will get impaired. So you will see improvement here in your gait, balance too. Now, if you come down, your esophagus, your respiratory functioning will improve. Definitely you're not going to breathe too high, otherwise in anxiety or stress you'll have such a high breathing. So you will get enough oxygenation to your lung muscles, coming to your heart. What I felt just few minutes ago, that I was so calm, I did not have to feel about any, I felt like my heart was completely in a resting stage, kind of dead. So my heart muscles got enough rest, enough oxygenation, so you don't feel palpitation. When you are stressed, you feel your own heartbeat, you will hear that, getting racing heart rate, pacing. Yeah, that's another reason why people who live in a stressful environment can have a lot of increase of heart disease. So you feel rested with your heart. Your digestion slows down, so you are able to digest properly. So I'm pretty sure today I'm going to eat properly and have a good digestion. And going down, like muscles, I felt so relaxed in my muscles. So muscles, blood vessels will expand, I will have enough oxygen, so I'm able to walk better. I will feel, so there are a lot of benefits. I just felt it. I don't know whether I'm explaining in a scientific language, but those are the benefit what major institution have explored and done a research. Now I prepared some of the question, and we can go through that. How much time we have? 10, 15 minutes, 20 minutes? So let me go quickly. So I prepared some question, and these are the common question I come across. And first question is, what are the scientific evidence of benefits of meditation, mindfulness on mental, to improve mental and physical health? So there are so many studies been done. Harvard University, if you Google, they have done major studies in this area. John Hopkins have done studies. Major institutions have done studies both on a physical health, physical and mental health. So in physical health, they have taken patients with the blood pressure who have a refractory hypertension, meaning they don't respond to traditional medications, blood pressure medication, and they have divided one group and asked them to do meditation, and they have done very scientific way. There are a lot of parameters were monitored. There are a lot of screening out protocols were done, and they have given them a 2 months 3 months meditations, yoga, versus there was another group, they did not have that benefit of enrolling into yoga, meditation, and mindfulness. So what they have observed, that group A, which had benefits or they practiced daily meditation, yoga, mindfulness, they have a significant improvement in blood pressure. So they end up having a lower amount of antihypertensive, and eventually they got off medication. I'm not encouraging you or anyone with the blood pressure to get off. Of course, you consult your physician, but the benefits are great. You will see benefit. They have done same studies in heart disease patients who have angina, severe heart disease, patients who are going through stent, and they found the benefit. They have seen a lot of improvement there. Systolic function, diastolic function, ejection fraction of heart, meaning how powerful your heart is. That's called ejection, how powerful your heart can pump blood to the rest of the body. So those parameters have improved. They have done stroke patients, patients who have mild stroke, complete paralysis, and they have seen improvement in their overall functioning too. There is another group called autoimmune disease like rheumatoid arthritis, lupus, chronic fatigue syndrome, chronic pain syndrome, and there's so many studies been done regarding mindfulness and meditation, and they have seen significant improvement in their chronic pain, their fatigue, and there's a lot of data available. When you are stressed or when you have a chronic inflammatory disease like this kind of disorder, your cortisol goes high, and it will increases your inflammatory markers in your body that will damage your system, autoimmune system, and that causes a lot of disease like SLA, lupus, rheumatoid arthritis, osteoarthritis. So they have seen improvement in their overall functioning, and many patients require lesser amount of medication. So there are so many things I can talk about on the physical aspect. On mental side, mental health, I had a patient, Caucasian patient, who had a severe depression. That was when I was seeing in a clinic, and I tried 2 3 different antidepressant, no much improvement. Patient never complied with the medication, and one time she came and said, "Oh, Dr. Parikh, are you from India?" I said, "Yeah." And she said, "Oh, I joined the yoga and meditation somewhere in Fair Oaks area." And I said, "Good." And then I started talking to her, and she was explaining how she's feeling so much better with her stress handling, coping. And surprisingly, after 6 months, I did some screening tools. Her depression score improved. And then she started taking medication regularly. Before, she would not take it. She would not believe that she needed medication. So her compliance improved. Her relationship with the family improved, because before she was getting very irritated, very kind of having a lot of conflicts, argument with the family. So that relationship improved. She was drinking at times, so she quit drinking, and there was significant benefit. And then after 2 years, she said, "Oh, I'm doing better. I don't need your services." I said, "Good. This is a good example." And then in my other hospital at Sierra Vista, where I practice, they started meditation and yogas, I think 2 years ago, after the COVID. And I just month ago, I had a patient who had a significant anger problem, bipolar disorder. And he just went there on Sunday classes in the outside patio. And Monday I saw him, and he said, "Oh, he feels so good." He was so nice compared to Friday. Friday he was so narcissistic, using effort to me, and said, "Go back to your country." And then Monday he apologized. I said, "Oh, Dr. Parikh, I'm so sorry. I'm feeling good." I said, oh, medication is working. No, I just went to that classes. It really helping me. So he inquired, he wanted me to give him more information that, do you know any classes here in Sacramento area? So that, another example. Then I saw another lady, I would not give ethnicity, but she was from East India, and she was getting abused by her unfortunately sister-in-law, gone through tough time, lot of depression, lot of anxiety, PTSD symptoms, and she would not comply, would not come to any appointment. Her PCP were calling me that, can you explain to or educate this patient how important for her to take her medication. But she started doing meditation, yoga, that I just suggested in one of the local center, and her attitude, demeanor have improved, depression has improved, her PTSD has improved too. So I have personally seen, I have so many examples. I believe in both, practicing both, now a lot of patients, you have to be careful, because here sometimes they say, oh, you are promoting your own value, Hinduism, like that. But there is a scientific data about this kind of studies, and I give them flyer, I give them brochure, and say, look, these are the studies, you can do it. Now the second question is, this traditional method can replace your scientific medications or methods to treat blood pressure, depression, anxiety? The answer is no. I think you got to take your medication. You can use as an adjuvant or supportive treatment to improve other treatment modalities, but you cannot just solely rely on one technique. Yeah, it will work, but it will take a long time. Before that, you could have a stroke from high blood pressure, or you could have a heart disease, or you could attempt suicide. So it's important that you listen to your primary care physician, your specialist, but implement this kind of practice in your life. Now, there is a talk about neuroplasticity. I don't know whether you heard about neuroplasticity. Anyone has any idea? So let me tell you. Oh yeah, that's yours. Thank you. So there are a lot of talk going about neuroplasticity nowadays. How meditations, good sleep, yoga can improve your neuroplasticity. What is neuroplasticity? Is how our brain get rewired. So if suppose the young child getting enrolled into piano classes, his brain will go significant adaptation or changes, will have a more formation or of neurons, we call neurogenesis, more synapses, meaning those superhighway in the brain which helps to transmit signals either electrically or neurochemically. So that improves significantly, because they are able to, the brain is able to produce millions and billions of neurons, so that they can acquire and learn piano or cricket, learning cricket at a young age. And the adolescent, especially the toddler and adolescents, have a significant flexibility, adaptability to improve their neuroplasticity. So that's why we say the kids, when they are young, they can learn many languages. It's good to put them in a different classes so that they can acquire more skills. Now as we get old, our neurons get kind of dead. It's called pruning, like how the roses get kind of pruned, and then new buds from the roses can come from the new new roses can come from the new buds. Same thing, your dead neurons, the neurons eventually become dead, and then the new neurons will come, but the growth is significant or more at higher speed at adolescent, toddler, of course adult, but in old age it slows down, right? So somebody who gone through significant trauma, especially as a childhood, what it happens, their brain gets into significant changes. It's called negative or maladaptive neuroplasticity. So their brain function will have a impairment of prefrontal cortex, their hippocampus, which controls your memory, amygdala, which is a main portion for emotions. What you mentioned about emotions, cognition, that's amygdala. So these patients will have a higher hyperactivity of amygdala, meaning it's a fear center. Like if you see some sort of spider, your amygdala will become super sensitive, hyperactive, and you will create a fear response. In turns, it causes increased stress hormone and increased cortisol, increased adrenaline. So your eyes will become wider, your pupil become bigger, so you can see there is a object which is kind of a scary one. And what it does, it sends signals to your heart will start pumping faster, so you feel palpitation, you will have a sweating, you will have sudden increase in blood flow in your muscle, so you tend to run away from spider or fire. That's our fight or flight response, right? So in this kind of patients who are gone through significant trauma early childhood, they have very abnormal or hyperactive amygdala, and they have significant negative changes in their brain. So they are more prone to develop anxiety, stress, memory impairment, comorbid medical issues. So that's called negative neuroplasticity. But if you slowly introduce those patients to good sleep hygiene, nutrition, encourage them to avoid drinking, exercise, meditation, mindfulness technique, deep breathing, studies have shown improvement. Now how can you determine that improvement? There is a scientific neuroimaging studies are done where you can see part of the brain which can improve in their functionality by having a glucose metabolism, blood flow improvement, and you can do neuroimaging studies. So in a lot of studies they have implemented this kind of measurement to have a scientific data, and it shows that this kind of methods help patients with chronic PTSD, anxiety, clinical depression, we call major depressive disorder. Now, I think I came across with one study in patients with dementia. I don't have much information on that, but I think it looks promising. So there are so many benefits, and the cost is zero. Is so the side effects is zero compared to medication. So I believe in those kind of technique, and I encourage my patients to consider along with medication. And again, it's not just about yoga meditation. A lot of time, I had several Hispanic patients and some Catholic, and I invite their priest to come to my hospital, talk to us, talk to the patient. We can take their feedback, and they will encourage patients to listen to me and take medication, so it improves compliance, and I'm able to discharge them in 3 days and 4 days from the hospital. So when you implement interdiscipline, various discipline, it really helps patients at large. And I cannot emphasize enough that our community, especially locally San Francisco, you might have seen cases where young kids have committed suicide. Last year we lost 2 people. Sacramento, we lost 3 to 4 lives from suicide. And when I hear that, it breaks my heart. That's why we started this initiative, suicide prevention initiative, and always believe in inviting folks like our BK institution, our brothers, sisters, art of living, because I believe in those, and they put their set up their booth over there. They educate people about what they are offering. So any resources you can seek from the local community in various ways, anything helps you, you always take advantage. And I have a lot of stories to talk about, but because of the limitations in the time, I will probably end now or keep going. I want to ask you, anyone has any question regarding benefits, physical, mental benefits of meditation? Yes, please go ahead.
എന്ത് എന്തൊക്കെയാ Oh, yeah. So not in the late phase. The dementia has a early phase, we call mild cognitive impairment, MCI. Those patients are still able to memorize, they are not at the end of dementia spectrum where they are completely forgetful, right? And those patients, they have a risk. What are the risk factor of dementia nowadays is a high blood sugar, diabetes, hypertension, hyperlipidemia. Those are the one main. Of course, there are some traditional risk factor, but if you control blood pressure, your cholesterol, exercise, proper diet, relaxation technique. And I have, have 3 4 patients who had an early memory impairment, and their family practice with them some meditations, watching some good uh, videos of their previous events, and really helps them to cut down that sundowning. There are not much data available, but you cannot practice same thing with the late or dementia, especially who are far away, in their memory spectrum. I'm not expert in meditation, so I will ask brother Yogesh to make a comment on that.
Well, I've only really practiced this one, Raj Yoga meditation. So this is the one I would recommend. But it depends on what a person's interest level is. Mindfulness can help some people. Some people choose to do mantra meditation, but Raj Yoga meditation is based on a knowledge and understanding of the self and how our consciousness works. So I think that knowledge helps us to be the master of our own meditation. That's the one that I personally would recommend.
Any other questions from the audience?
All right. How do you pick the one that works for you? I think it's like you need to know what you're looking for. It's like when you go to a supermarket. If you don't know what you want, you end up buying everything. In the same way, am I looking just for some peace of mind? Am I looking for a deeper meaning in life? Am I looking for handling stress? Am I looking for God? So to know what my need is, and then I think from that perspective, you investigate what are the different meditations available. So I think that's the starting point. No?
But all meditations help you improve your life, right? Yeah.
Yeah, I mean,
which one you pick that do help you to improve your life, the way you morally think, and even it's just a stupid thing in my mind. Even now, when you guys are speaking, stupid question. My mind is just playing thinking. How come these two guys can so talk? Can't talk. Don't get nervous in front of all these people. How come I cannot? That sort of thing plays in my mind.
I think you might be good in your whatever you do, right? And this is what we do from the practice, again, practicing same thing again and again, what Brother Yogesh said. Same thing with meditation, practicing initially start with 2 minutes, 3 minutes, and then, doing more and more can improve, your meditation technique. Same thing with us. We do a lot of speaking in public. I remember first time 20 years ago when I had to speak, I was kind of shivering, but with the time you kind of get more experience and you feel comfortable. And I don't know, practice, yeah. And I don't know what you do in your what kind of your professional life, what do you? So you might be good in IT. I'm zero in IT, so you are expert. So everybody has their unique qualities. They are good at what they do, right? And this is what we are doing. It's not that like we are perfect, but we are comfortable doing it. Yeah. Yeah. And I believe in learning, that's why I was paying attention to Brother Yogesh, and I picked so many good, teaching, and what he was talking about, inner consciousness, structure, visual, imaginary, and that really what we do in our practice in medicine to psychiatry. A lot of therapists exactly they practice cognitive behavioral therapy, exactly what our brother has talked about today. So has a lot of scientific evidence on what we do, and be in touch with your your support system, your faith. And I can say we are very proud that we have such expanded system of support, family, community, all this faith based resources, and the BK center. There are so many centers we have here, and they can provide a lot of good services, and other community are not fortunate in that sense, but we are so lucky, and we should take advantage rather than comparing ourselves with our neighbor. If we buy big car and I have Tesla and I get depressed, no, enjoy the life. You just have to feel good, what you have, satisfying. Oh, definitely, yeah. I think they are able to understand better. They are able to focus better. They are able to learn. So meditation helps prefrontal cortex. So that helps with your learning. I'm sorry, the hippocampus. So it helps with your memory, and it also helps with your learning. This part of the brain, of course, executive functioning, but also concentration, attention. And I have a lot of research studies, the data that the meditation has shown improvement. So when they are able to grasp or learn better that, oh, medication will help me, oh, the blood pressure medication I needed to take regularly, so they are able to reasoning, logical reasoning, much better, learning better. They are able to understand the benefits versus risk or side effects ratio, so their compliance improves, and they don't feel that tense, like anxious about taking medication. And I've seen in a lot of patients. Yeah, clarity, exactly. You good word. Yes, please.
Yeah, it's okay. I mean, Sister Hansa's next to you, so she can guide you very well. But yeah, yeah, when people are new, sometimes you do feel these sensations, but I think it's good. And after a while, those things settle down and the experience becomes deeper. So I think it's the initial phases. So just keep going. Feet were tingling. Yeah, I mean, what we experience in the mind, manifests in the body. So a deep experience can initially cause some kind of sensations in the body, but that settles down after a while. Yeah.
Another thing I want to talk offline, that a lot of medical institutions, psych institution have implementing this kind of methods in their daily, structure. Like we have a lot of groups, where psychologists, therapists will talk different stuff. But then Saturday, Sunday, we have this yoga classes, some meditation. Uh, I got a warning from my wife that you do too much for community. Now you need to take care of yourself. So I started joining Club Studio, And just 2 weeks ago, and every class, if you know muscle strengthening, high intensity classes, they have 5 minutes of this relaxation meditation. Even this morning we were doing high intensity exercise, and there were 5 minutes of meditation, relaxing technique. I was so impressed, so it's, I think people see the benefit, people realizing that they have to, rely on this kind of technique, which has a huge benefits. Again, depend, like what, first of all, what kind of problem do you have? Like, like if you're OCD, you need not only psychotherapy, you need medication. Patients who have severe depression need medication therapy. Even if you don't do nothing, untreated depression would last 6 to 12 months, but you go through all the misery, pain, suffering. And if you take medication, 60 to 70% will improve by 6 months, 70 to 80% will improve by 12 months. Only 20% will have a relapses if they stop taking medication. If you implement both therapy, which is psychotherapy, medication, the improvement, the compliance, or the recovery is 70 to 90%. A big benefit. So you don't leave psychotherapy, you don't leave medication, that's important, but this supportive additional source of, method, if you implement it, has a good advantage. Yes, please. uh, again, what are the signs, symptoms of clinical depression, right? First thing is, your family, friends will say immediately there is something is wrong with this person, there's something, is acting bizarre, acting strange. That's a first warning sign. It won't say anything in any book, but if you see sudden change in your personality, your behavior, that's concerning. Second thing is your sleep pattern. So whether you are poor sleep or sleeping too much, that's called hypersomnia, or poor sleep, insomnia. Or if you have a decreased appetite or too much appetite, we call hyperphagia, means that's concerning. Then you isolate from your family, friends, you become, kind of stagnated, you have anhedonia, meaning you don't have any energy, no interest in doing any activities. You lose interest, you lose, affects your concentration, affects your, personal life, your work functioning, your social functioning. And most important, the warning sign when they talk about, life is not worth living, that's a huge sign. They should immediately get help, when they talk about suicide. And a lot of time we have a stigma, we feel kind of shame when we have family member with suffering from mental illness, because we don't want them to look bad in front of our, community or friends, because their kids might be successful and our kids might be struggling. But it's a biological illness, it's easy to treat. We have so many medication nowadays compared to when I started. There's so many things to pick up, and they are safe nowadays. Of course, medication, each medication, even if you take Tylenol, will have a side effect. As long as you are getting monitored by professional, it's much better. We have other technique, shock therapy, we have transmagnetic stimulation, TMS, we have ketamine therapy. Now psychedelic is in, discussion about using it. So there are so many advances in depression. But those 8 to 9 signs which I described earlier, if you see someone, always encourage them to seek help. Last problem I see in our community, especially in female, domestic violence. When we did a women forum through Indian Association and other API community, we invited 10 to 12 women from each ethnicity, Indian, Nepalis, Muslims, Punjabi. Two common problem. The first problem every woman said was a domestic violence, and second thing was a depression. So don't be shy. If you face any issues like that, seek help. Talk to Sister Hansa, Sister Johnny, get help. We have a My Sister's House in locally. They provide resources for women with the domestic violence and patients with. I have three female that I have treated just within last 2 years. Very, very tragic stories, but they eventually improve with help from My Sister's House, medication, therapy, community support. So even though this is a off topic, I thought this is a good audience to bring that attention of the audience. Depression has a lot of reasons. Could be genetically, could be from even if you're low thyroid, you could have a depression. uh, Cancer patients could have a depression. So there are so many reasons. So when we see somebody with the depression, we always do a lot of lab workup to rule out any medical causes. 2 years ago, I had a patient with the 40-pound weight loss, and they cleared him from emergency room, came to me in the hospital for severe depression, but he did not look depressed at all. He looked kind of fatigued, tired, and I did some blood work, and I called my internist, called hemato-oncologist. A week later on, he was diagnosed with a blood cancer, but he got first symptoms was depression. So you need to rule out all this thing, but there are a lot of help available. Seek help, don't ignore. There's so many, right now with the limitation of time, but I can talk to you offline. There's so many things, can be ordered, it depending on how they are presenting to us.
Om Shanti. Before we go to next segment, I would like to address the Zoom listener. So I see iPhone 2. So do you have any questions? iPhone 2, do you have any questions for Brother Yogesh or Brother Dr. Bhavin? iPhone 2, I see your hand raised. If not, that's okay.
No, I think by mistake, Shanti.
That's okay. But we liked your golden hand. Thank you very much. So now I will hand over to Sister Hansa.
Thank you.
You're welcome.
Om Shanti. Technology is teaching us certain things. This microphone is telling that keep me away from your lips. Keep me on the heart. When I'm keeping it in the heart, it's not humming, right? Is it humming? No. So it says that don't keep like that, keep like this. Okay? So same thing we have to figure out our mind. Same thing we have to figure out our mind in which position we have to keep. Otherwise, it will be humming or making noise, which we will not like, right? I think keeping here feels little okay. So meditation. So today is a very good practice of being point of light while listening, not to listen. Anyway, there are several beautiful aspects that both the brothers have offered us, and we all will pick what we need and we will use it. One of the things I remember, there was a special psychiatric conference in Mount Abu from all over India. More than 2,000 people were there. And one of the things they mentioned is keep smiling.
Laughter therapy.
Yes, and the laughter therapy, right? Smile and then laugh. There are so many little things. They said every day morning, when you look at the mirror, just tell yourself, I am beautiful. I am God's child. I am special. I am thankful. Whatever you have, you may don't have things that you expect. It's a long list you may have, but you will have a list that you feel privileged, and count your blessings and laughing, clapping, tapping. So all these little things, if we make it part of our daily routine, then it becomes easier to maintain. Our one of the great yogis always said that every day morning, open your hand, rub your hand, and think God's blessings in my hand, and then think God's hand of blessing on my head. And in 21 days, you feel how your brain is functioning differently. In whatever God you believe or whatever divine power you believe. So there are certain natural formulas that can be very useful. Plus, Yogesh Bhai has shared very beautiful aspects also. So now we will be closing it. We took little extra time, but I think it was worth. And I will invite Vijay Ben, Meena Ben. So we will have little honoring ceremony to both the brothers. And we are happy that Dada is with us. Babu Bhai is our long time well-wisher. And he has been to Madhuban also. He has so much loving relation with Dadis. And so, Vijayan, you can offer this sash to this both the brothers and Babu Dada, Babu Bhai also. And there is a little pin which says you make difference. Like that. So. And then we have some gifts for Babu Bhai family and Dr. Bhavin family.
Oh, you don't have to give me a gift. This is
It is a special shawl. It's a special shawl from India. Is a blessing. Our gift is a blessing. And then we will have little moment of silence and everybody will have some prasad and we will conclude the session. Om Shanti, Om Shanti, Om Shanti.
good sense of humor.
ભાવિનભાઈ દાદા તમારા કારણે આવ્યા છે ને? આવી જાઓ દાદા. કેટલું ટ્રાય કરો, કેટલું ટ્રાય કરો અહીંયા સુધી આવી જાઓ. That's very good. Yeah. It was like a family evening, so don't know the formal thanks, but still we are appreciating everyone's kind cooperation. And whole 2 days, Sunday and Monday both, it was a quite packed day and made us also fill with lots of energy. So can we clap for both? And those who are on the Zoom, more than 45 people join on Zoom is very good. And those who are newcomers, first timers, or recently coming, from Monday, next Monday onwards, there will be 5 days Raj Yoga meditation class, and 2 Sundays will be silence meditation retreat. So please join us on our Facebook or our website, and you will get more details. Om Shanti.